I firstly want to extend my deepest sympathy to those families who have been bereaved by COVID-19 and to all of those who are ill with the virus, either in hospital or at home, to wish them a full and a speedy recovery. This piece of legislation is another extraordinary piece of legislation before us. Just as we were here last week, we live in unprecedented and very strange times. I think it's Part 4 concerns the changes to allow former registered health workers to rejoin their professions and work at the front line. Part 5 concerns a number of substantive amendments to the Mental Health Act. I welcome the provision and the changes that are being made in Part 4, and I hope that this allows for the speeding up of the process for re-registering for those health service staff who are retired, who want to come back and do their bit. It will also help those who practised here and moved abroad to re-register quickly on their return. I'd like to offer significant thanks to the relevant boards, to the NMBI, to the Medical Council, CORU, the Pharmaceutical Society of Ireland, who will be processing the huge numbers, we hope, of new applications. I know that these regulators and their staff are doing huge amounts of work at all hours of the day and night to get these applications processed in a timely manner. Similarly to the HR department of the HSE, they too are working night and day to process the applications and get as many health workers to the front line as possible. In the midst of all of this, I want to thank them for their hard and very often unseen work. To the staff in the health service, the retirees returning, and to our emigrant healthcare workers coming home, thank you so much for the work that you are doing. And Minister, I do think it is regrettable that we won't be able to register people, particularly where there's a mutual recognition of qualifications. We need everybody, and if those people are willing, I think you should look again at that. I know from speaking to many frontline healthcare workers that the kindness and generosity shown to them by the public is a real powerful motivator at this time. I also know from speaking to these health workers that they are concerned about the lack of personal protective equipment. Politicians will know that health workers do not reach out to us unless they really believe there is an issue which requires raised publicly. Doctors, nurses, home helps, ambulance personnel have all reached out to me in the past 24 hours to raise concerns about the lack of PPE items as they go about working at the front line of the fight against COVID-19. They are aware that there is a global shortage of PPE. However, they reached out because they were angry and upset at claims being made by health officials and health service management that we have an adequate stock, when the reality on the ground is that we do not. I want to read you a message that was sent to me by a worker on the front line. This person asked to remain anonymous, and I am respecting that request, but we need to hear what they have to say. They said, "Healthcare workers are putting ourselves on the line for the nation. The minimum soldiers expect is armour. For us, that is PPE. And quite frankly, it's an insult that legitimate concerns about low PPE stocks on the ground were disparaged by a senior HSE official in the Business Post on Sunday, who said that they were panicking. That was humiliating and an insult. We were doing nothing of the sort. We were telling the truth. We know there is a global shortage. We know the HSE is trying, but let's be honest, we shouldn't be this low this quickly. No one should die at work because of not being protected. And when the stocks are short, HSE must be honest and tell us and prioritise those who are most at risk." The current situation is becoming more and more difficult as we wait for supplies of PPE to arrive, with 24% of those affected by this virus being healthcare workers. I know that we're being told that we have orders of PPE arriving, and that is most welcome. However, in the here and now, frontline healthcare workers are telling us that there is a very real shortage of PPE. This is reflected in the campaigns that many hospitals are running, asking for immediate donations of PPE from companies or individuals who might have some. And I would urge anyone that does have any such equipment to come forward and to donate it. We're all in this together, but our healthcare workers are on the front line of this emergency. I would urge the Government to secure a reliable domestic production of various items of PPE so that we can be assured that we have a stable, steady and reliable supply of this vital equipment. Yesterday I asked the CCO, Dr Colin Henry, to brief TDs with the specific advice from the World Health Organization which prompted the change in advice regarding testing. The WHO says test, test, test. They are very clear. Minister, you need to understand that there is a real fear in our communities, and this is added to when people who are told last weekend that they need a test are now told that they don't need a test but they should stay at home and behave as if they have this virus. This change is causing a huge amount of worry. And these people are coming to us. They are very nervous, they are very upset, and they are worried to be told one day to have a test and then the next day that they don't need that test. I want to conclude by thanking the Bills Office and the various departments who worked long and hard to draft this legislation. Thanks also to the ushers, to the catering staff and to all of the workers who keep this House running. The implementation of this legislation will go a long way to getting healthcare workers to the front line as quick as possible as we work to tackle this crisis.